Good morning, I'm Ed Ullmann from Wellness RX. Today, we begin a series of modules on some of the immediate challenges that are really facing our American healthcare system. Today, we're going to look at the shortage of healthcare providers in our country. Interesting, but with the exception of pharmacists and some secondary providers, experts are now predicting a need for between 30,000 to 45,000 primary care providers, about 50,000 specialists, and the need for most other health professionals we have a shortage of, and especially in the field of nursing and in mental health professionals. Both those fields are so needed, especially as we move through the COVID episodes. The need is guaranteed to grow, and this is the shortage as we look at it, because we're living longer. Providers are retiring earlier than ever, and the cost of treating chronic conditions such as obesity and diabetes and heart disease, dementia, and COPD will only increase. When you drill down today, 5% of Americans account for 50% of all the healthcare spending in America. That's right, just 5% of very sick Americans account for 50% of the spending, with that highest spending occurred during the last year of our life. Making sure that we handle those individuals with dignity and compassion and to try to manage that care is a great challenge, but it's also a great opportunity because it's the way that we will be able to reduce costs the easiest. It is estimated now that our senior population will grow by 40% over the next 10 years. And interesting that 2 out of every 5 physicians that are practicing today, that's 40%, will be over 65 in the years to come. Now, the challenge we're going to have, are we going to continue to see early retirements? And if we do, can we afford to lose the wisdom and the experience that our senior providers bring to the healthcare system? And the area that really hit me just recently is in the nursing profession. You know, we don't have a shortage of folks who want to become nursing students to become nurses. What we're having a shortage of is the educators, the trainers. And so as individual senior nursing folks who have spent so many years training and being mentors start to retire early, we're not having the easy ability to just replace them. So we turn around and then we look at where are we, the United States, and compared to other industrialized countries. Well, we have the lowest number of physicians per capita than any other industrialized nation. So it's a lot of money we spend, but in reality, we do not have a high physician population. And we average now about 2.5 physicians per 1,000 people. And then on the high end, the country that has the most physicians for their population is Sweden. And they have about double what we have, about 5 physicians for every 1,000 people. And in the past, we've kind of looked and relied on international students, especially doctors that wanted to come and to practice in the United States. But COVID has kind of interfered with that migration, and getting into a residency program has been very difficult. So we cannot rely just on international students that sometimes can account for up to 10% of all of our doctors. Now, under normal economics, this shortage of health professionals would easily be met by an increase in supply. We have the individuals who want to become health professionals. In fact, right now, if we look at it, coming out of COVID, our young folks in this country are applying to medical school in record numbers. So why can't we get the supply? Now, healthcare is different, and that's the key. It's different than other commodities that we have in our economy. And in the cost and the time that it takes to train a new licensed healthcare professional is demanding. So for example, a physician has to go through 4 years of college, and then they go through 4 years of medical school, then they have 1 year of an internship, and then they go into a residency program. And the minimum is going to be 2 years, like for a family practice physician, but it also goes up to 7 to 8 years for a individual who wants to have a subspecialty. That's a long time. That means that the bare minimum for a individual to become a doctor in America is going to be about 11 to 12 years. So it takes time for that. And well, the other thing that I think what we're really looking at, and it was really, okay, if that is the case, and the residency programs are really important, why don't we just expand and have more residency programs to allow more individuals to be trained? That would be logical. But reality is that we have not increased the number of residency positions in the United States for almost 10 years. Now, it turns out that the residency positions, which are at hospitals, are paid for by Medicare dollars. And there has been a cap at the national level, and this is a legislative situation that would have to be approved, that has not budged. And so therefore, we do not have more residency positions in America unless somebody other than the government is going to pay for them. And we haven't seen great numbers in that case. So what do we have? We have an escalating increase in demand that folks want to become health professionals, and we don't have the positions both on the residency side or in the teaching positions. To try to understand this a little bit more, because if you drill down and then look at the mid-level professionals, these are our nurse practitioners, this is our physician assistants. Well, evidence is showing that they are relatively a low-cost entry to provide primary care. Their productivity have been almost equal to doctors, and patient satisfaction's high. So let's create more mid-level professionals. Well, up at Albany Medical College, which is in upper New York State, they had over 3,000 applications for 42 training spots to be a physician assistant. Now, that was 3,000 for only 42, and we now have an escalating increase in applications to become mid-level professionals. That means that next year we're going to have 5,000 applications for 42 spots. So that's our challenge that we have to understand, and it's just not going to change. And we have to accept that the current scenario will not allow our supply to meet the demand. And then I started to look at that, okay, what we do have perhaps the greatest technology. And in order to hopefully become more efficient with the provider's time, to be better at quality of care with the power of better information. So I go, well, can that help us? Well, when you look at it, they're now estimating that 30% of a physician's time is tied up with paperwork. And where does that come from? Increased regulatory requirements, increased demands from insurance carriers, increased demands from new health systems that continue to consolidate. Now, the average doctor gets paid over $187,000 a year plus benefits. I don't know about you, but that doesn't appear to me to be the greatest use of expensive labor, having them spend 30% of their time with paperwork. And it certainly is not going to increase a greater clinical availability to see patients. So I'm not looking to technology right now to be our friend for increasing the supply of providers. So in the near term, I think what we have to look at that Americans got to brace themselves now for a healthcare system that is going to provide more complicated access, not less. You're going to see more consolidation of the industry, not less. And we're going to see now unpredictable service. It's going to be a little bit different. Things that you would say, all right, just send the medical records over to Doctor 1 to Doctor 2. No, it's not going to be quite that easy in the future. And we have to brace for this. Appointments are going to be pushed out more. We're going to have all of a sudden another announcement of someone that decides that they are going to quit. We had now, through the mandate of vaccination and with early retirements, an estimation of about 3% of the entire national healthcare delivery system, our providers, have gone away. We haven't replaced them. So kind of get the sense and have some compassion and sensitivity for the administrative staffs, because they are under the gun and they're trying to do the best they can, but we're going to have to get used to this. And my prediction is there's going to be a continuing increase in passing on costs to the consumer. It could be deductibles, could be co-pays, it could be services not covered, whatever it might be. So we have to go forward and understand this and look at solutions. Our next module that we're going to be looking at is going to ask the question: is society receiving its money's worth, spending 18% of our national wealth on healthcare? And we'll try to drill down on that question. Thank you today for taking time out of your schedule to listen to the module, and I look forward to talking to you again.